tonight on CBC Vancouver News.
It's absolutely shocking that things could actually get worse than they have been.
Deadly May. BC records the highest number of fatal drug overdoses in a single month. Also,
for me to stand up here and say I'm going to end something today is basically impossible.
Vancouver's mayor calls for the province to review policing across BC. And
I have reviewed that plan, and it exceeds the requirements that we have in place even today.
staying out of the pandemic penalty box. Why the NHL's Hub City proposal is getting the thumbs up from BC's top doctor.
This is CBC Vancouver News.
Good evening. A grim statistic today overshadowing the coronavirus pandemic. BC's drug overdose numbers have soared.
in May, they reached their highest monthly total ever. More overdose deaths last month in our province than the total number of people killed by COVID-19.
Brett Soderholm looks at two public health crises, one making the other worse, and a warning. Her report does contain some profanity.
Right there, $120.
This is what $120 of fentanyl looks like on the streets. Danny Ross sells it and says it isn't hard for him to get his hands on drugs these days.
Is it the police?
But when it comes to using, he has one rule.
I never use alone. If you use alone, you're fucking dead. You're gone.
For years, thousands in BC have been dying from toxic fentanyl. But now, in the middle of a global pandemic, it's getting worse. The number of deadly overdoses started rising substantially in March. Then last month, a dismal record, 170 deaths, a more than 90% increase from May of last year.
I cannot express how difficult this news has been to hear.
Health officials say the drugs have become even more toxic. Border closures have disrupted the supply, so the drugs on the street are being cut differently.
It's a sad state of affairs right now. You know, we have people dying every day.
And people are turning to new sources to find drugs.
Before, I would buy from 3 different people, and that was it. Now it's hard to do.
Another issue, safety protocols to help stop the spread of COVID-19 has meant many safe consumption sites can only run at half capacity, and there are fewer places to test drugs.
A lot of the SROs or single room occupancies aren't allowing visitors in, and people are using alone and they're dying, right?
Hey, you all right, man?
Trey Helton says the one good thing to come out of the pandemic is that the province expanded access to safe supply, so synthetic opioids can be prescribed to more people. But right now, most are still turning to the street, and what they're finding is even deadlier than before. Brett Soderholm, CBC News, Vancouver.
And as you just heard, Dr. Bonnie Henry held back tears today in talking about the spike in overdose deaths.
The province's top doctor expressed her condolences to the family and friends of the victims.
I cannot express how difficult this news has been to hear. My thoughts and condolences go out to the families and friends of those who have lost their loved ones, and I share your grief. These are our brothers and sisters, our co-workers, our sons, our daughters, our friends, our community. And the extent and challenges of these crises that we are facing, both the overdose crises and on top of that, the COVID-19 pandemic, have really stretched our resources to the limit.
Yeah, dealing with these overlapping public health crises in our province. As you know, she's extremely passionate about the opioid crisis. I interviewed her late last year over in Victoria, fully committed to safe supply. And she says the supervised consumption sites definitely work. Drug checking works. Reaching out and not using alone works. That's one of the big problems right now with COVID.
A really unfortunate day, and one that has clearly shaken her.
Absolutely.
Well. And for the 6th straight day in BC, there are no new deaths connected to COVID-19. However, there are 14 new cases of the virus. That marks the first time in more than 3 weeks where the province has had consecutive days of double-digit cases. The number of active cases is up by 3, bringing the total to 183. There's also been an additional hospitalization and another person in intensive care. The number of recovered now stands at 2,344. BC's progress has led to the easing of another restriction. Restaurants will no longer be required to operate at 50% capacity.
What we now are requiring is that every restaurant, pub, or bar has to identify a number for their capacity. That includes the patios, and this was one of the complicating things. As you're expanding your patio, how do we know what number to use? So it will be done in collaboration, and we'll have a defined capacity.
The order says there can be no more than 6 people in any party. If a 2-meter distance can't be maintained between tables, a plexiglass partition should be installed.
And BC's top doctor says she's on board with trying to get the NHL back in Vancouver, but she says there will be no exceptions made to our province's quarantine rules.
Dan Barrett joins us live with more now on this. So Dan, how would BC allow Vancouver to become an NHL hub and maintain our COVID-19 rules?
We know Premier Horgan is keyed up to have Vancouver chosen as a hub city for a modified return to hockey. Horgan says BC's success at fighting COVID-19 ought to boost the chances of Vancouver being chosen. Dr. Bonnie Henry says the NHL has now provided a proposal to Ottawa and the province that might work in late summer or the fall. Teams would be in groups of less than 50 in a, quote, household bubble. They'd undergo strict COVID screening and testing, and they would have to stay in their bubble the whole time they're here, not just for 14 days of quarantine.
We have reviewed that plan, and it exceeds the requirements that we have in place even today, and it meets our criteria for protecting our community without compromise. Teams would have no contact with the public, with no spectators, and no families.
Okay, Dan, the big question always when we talk about sports opening up, what happens if someone on a team tests positive for COVID-19?
Very good question. It's not exactly clear quite yet. Dr. Henry says if someone on a team did test positive, there would be a plan in place for how that team would be isolated like in other settings.
There was the possibility, of course, and this is, I think, what the NHL was most concerned about. If people do test positive once they're in that bubble, that could affect the entire tournament. So there was provisions for what would happen with that.
Again, Dr. Henry stresses this proposal could be for late summer or the fall, but that is still a maybe. Anita, Mike?
Dan Barrett, live for us tonight. Thanks, Dan.
The man charged with 2 counts of first-degree murder in the killings of a Vancouver couple in 2017 has been found guilty.
Rocky Rambo Waynam Cam killed 64-year-old Diana Ma Jones and her husband, 68-year-old Richard Jones, in their Marpole home. CBC reporter Rafferty Baker is at BC Supreme Court now. Rafferty, tell us about the judge's decision.
Well, Rocky Rambo Waynam Cam admitted all along that he had killed the couple. He told the court that he saw Ma Jones unloading groceries into the house. He hid behind a tree and then attacked her before forcing his way into the house. He tried to choke her and then cut her throat. Cam said he then attacked Richard Jones, a retiree who used a walker and had some health issues. Cam said he used a hatchet and knife to strike him repeatedly. Evidence from the autopsy revealed Jones was stabbed more than 100 times in the brutal attack. Cam said he drank milk from the fridge because he was thirsty and ate a peach he found before dragging the 2 bodies to a shower stall in the house where they were eventually found.
Okay, so Rafferty, Cam admitted to the killings, but not entered not guilty pleas. Rather, what was his defense here?
Well, his lawyer argued that he was often immersed in video games and fantasy. A clinical psychologist coined the term during the trial, video game consciousness, and they argued that he was in an altered state. Now, the lawyer argued that Cam was guilty of the lesser charge of manslaughter, but there wasn't intent, and the judge found that argument unconvincing. Evidence at the trial showed Cam had researched weapons and crime scene cleanup online in the weeks before the murders. As well, he'd gone to Canadian Tire twice, where he bought a hatchet, knives, twine, and gloves, all items that he would use during the murders. The judge called the killings incomprehensible, but she was satisfied that there was planning and intent beyond a reasonable doubt. And now a first-degree murder decision does come with a life sentence with no chance of parole for 25 years. Anita, Mike?
Rafferty Baker live for us tonight. Thanks, Rafferty. Well, City Hall's life-size statue of English explorer Captain George Vancouver has been vandalized. Early this morning, workers were seen removing the blue and gray paint with a pressure washer. The motivation for the vandalism is not known, but a number of statues depicting explorers and Confederate leaders have been pulled down or defaced in the U.S. as protests against systemic racism and police brutality continue. In response to the defacing, the city of Vancouver says it recognizes the public dialogue taking place around historic monuments and Vancouver and elsewhere.
With the growing number of hate crimes being reported to police, there's an expectation cases will be investigated and charges to follow.
But as Arlene Young explains, that's often not the case because actual hate crimes are technically rare in Canada, but advocates say that should change.
Say you're walking down the street minding your own business, and then this happens.
Going down the road, no one's going to like the Chinese community because you seem to be culturally insensitive and you don't adapt. I made my views known. I made my views known. This is a free country. I'm able to make my views known. All right? Because we're mad. All right? We're mad. We're mad at China. We're mad at the Chinese culture.
That happened to Carol Chu.
We actually let him talk for about 2-3 minutes till my friend started recording because he wouldn't go away, and it wasn't a conversation. He was just ranting at us.
Carol shared that video. She was upset. So were her friends. They encouraged her to act.
If my friends tell me we should report to police, I thought about it. But when you think about the content of what he was saying, it wouldn't qualify for hate crime.
What is the legal definition of a hate crime in Canada? Carol was right. While many minorities are reluctant to call police, even if you were comfortable enough to call, a racist rant filled with slurs likely wouldn't have qualified as a hate crime.
Once it turns into a threat then becomes criminal, a threat to someone's life. But if somebody just, like you said, utters a slur, that's racism. And racism isn't criminal in Canada.
There are limitations, but freedom of expression is protected under the Charter of Rights and Freedoms, the most powerful piece of legislation in the country. Under the criminal code, there's nothing even listed as a, quote, hate crime. The closest you get are some very specific offenses that deal with hate, like promoting or advocating for genocide, or publicly inciting others to act on racist propaganda and speech. The scope for these offenses is narrow, so it's not often used. What's commonly thought of as hate crimes are what police call hate-motivated offenses. Crimes like assault or harassment, and it's only during sentencing that a judge takes into consideration the hatred, racism, or bias, which can lead to a stiffer sentence. How rare are hate-motivated offenses then? The latest stats show in 2018, police logged nearly 1,800 crimes motivated by hate. Of those, the majority were racially motivated crimes. But even police recognize hate crimes are vastly underreported. Research shows as few as 1 in 10 are ever reported. So how effective is our system at dealing with hate crimes? Legal aid lawyer Avi Go says it depends on the people applying the law.
So I think we need a lot of education for all the players in the criminal justice system, from judges all the way down to police services.
She says police often don't take hate crimes seriously enough, dedicating few resources with only 1 or 2 officers per hate crime unit, if there even is one. And judges and lawyers don't understand how hate crimes can shake up the psyche of victims and the broader community, leading to reluctance to prosecute or weaker sentences.
It's kind of wishy-washy. It's not very precise. It doesn't include a lot of the incidences we've spoken about, and it needs to be completely revamped.
Hate crimes have a significant impact, and with such a narrow scope, researchers and advocates say relying on the criminal justice system isn't the most accurate way to reflect the frequency of these incidents.
Right now, the community groups are the ones who are filling the gaps, but that shouldn't be the case. I think it's up to our governments to think about what other ways can we report and allow victims to report these incidents.
A change that would require public and political will to tackle the issue. Leanne Young, CBC News, Vancouver.
And calls to defund the police are gaining momentum since the death of George Floyd in Minneapolis.
Today, here in Vancouver, Mayor Kennedy Stewart addressed concerns about the VPD's swelling budget. The city won't make any promises to clamp down on spending.
As John Hernandez reports, leaders are calling on the province to review policing across BC.
In the end, the buck stops at the province.
With Vancouver's swelling budget under scrutiny, Mayor Kennedy Stewart made sure his message was clear.
If we wanted a fundamental change in policing, it can only come through the province.
Calls to defund the police are echoing across the world, a movement sparked by the murder of George Floyd. In Vancouver, $340 million municipal dollars earmarked for the VPD are raising eyebrows.
We want to make sure that the police budget is reduced and the funding goes to the community to really build safer and healthier communities. So we want to keep this momentum, and we want to make sure that we build a new society.
Advocate Lama Mugabo is calling for an end to discriminatory street checks in Vancouver and reinvestments of police money into things like mental health services. But when pressed on what changes the city could make to local police, the mayor couldn't make any promises.
For me to stand up here and say, I'm going to end something today is basically impossible.
Instead, the city says those decisions are up to the province. Today, a plea to John Horgan to launch a review into policing province-wide.
All police, including the Vancouver Police Department, other independent police departments, and the RCMP.
A deep dive into systemic racism and police violence against Black and Indigenous communities, with the goal of sweeping changes province-wide. Some advocates are already calling it a step in the right direction.
We look at the Premier to really make changes that are meaningful. They have to listen to us. They have to listen to the victims.
The VPD says it's willing to participate if it gets the call from John Horgan, and they might get that call soon. The province has confirmed plans for a review are already in motion and will be introduced into the legislature later this month. John Hernandez, CBC News, Vancouver.
There are calls tonight for a Vancouver high school to be renamed because of the current connection to crimes against humanity. Gladstone Secondary is named after William Ewart Gladstone, whose family owned more than 2,000 slaves at a Caribbean plantation. Vancouver Kingsway MP Don Davies wants to see the name changed, especially given recent calls to decolonize BC. Gladstone served 12 years as Prime Minister in the UK and actively campaigned against the abolition of slavery. The Vancouver School Board says it hasn't received a request to change the name, but it says it is possible if there's enough school community support.
WorkSafe BC is investigating an allegation of cultural insensitivity against the city of Vancouver. An Indigenous woman who worked for the city at Oppenheimer Park alleges she's traumatized by a culturally unsafe or insensitive workplace. She says she wasn't targeted herself, but witnessed racism and dehumanizing treatment directed at homeless residents in tents, many of them Indigenous. The woman went on stress leave, and though her claim was originally denied, a review found it was not properly investigated.
It's time to make your voice heard. CBC British Columbia is hosting a virtual town hall to discuss racism, and we want to hear from you.
It's a global thing.
Just because I was an Asian.
Things like this should not exist.
But they need to hear our voices.
Send us your thoughts and stories by heading to cbc.ca/racism town hall. Unmasking Racism, June 17th at 7 p.m.
Tune in on CBC Radio 1, Facebook Live, and on GEM.
Well, it's easy to get caught up in the numbers during a pandemic. 167 people have died from COVID-19 in our province.
We've been hearing from families who want you to remember that each of those people are just that. They're people, they're not statistics. That's why they are sharing their stories with us.
Ragbir Dosanjh was one of those people, and his family sat down with the CBC's Jesse Johnston.
Ragbir Dosanjh almost never made it to Canada.
And he got stopped by immigration in Toronto saying, well, you're coming to Canada and you only have $5 in your wallet, and they were going to look over his case and maybe send him back.
His face had the kind of depressed look that only comes when the future of your young family in India is in the hands of immigration officials. It's a good thing, too, because two people he'd never met before asked him what was wrong.
Just imagine 1970, these couple took out $100 each from their wallet and gave it to him.
Dosanjh became a Canadian on Remembrance Day, 1970. He worked for years in a lumber mill, saving enough money to move his family to Abbotsford.
All 6 of us were in one room on a farm. Imagine 6 people with all their belongings in one room. So we worked really hard. Dad was a hard worker. You can tell a Canadian when he's in a suit and tie and on a bike.
He'd work weekdays at the mill, toil the berry fields alongside his children on his days off, passing along his strong work ethic, saving his money, always strict with his children as he built a good life for them. And then the grandkids showed up.
When I tell the kids how strict he was when we were growing, really? That was Grandpa?
After decades of hard work, Dosanjh retired and finally relaxed.
Spending time with his grandkids, you know, going to the temple, going to the community, seeing his old friends, walking, exercising.
But in January, Dosanjh had a stroke. Months later, the rehab center where he was working on his recovery had a COVID-19 outbreak, which the family learned about on the news. Rav brought his dad home, then he got sick and was hospitalized. Then Rav got a call the next day saying his dad tested positive.
They were going to put him in ICU and give him oxygen. Everything happened so quickly. That same night we get a call saying, we don't let anybody in the hospital, but you guys can come and say your final goodbyes.
Dosanjh died April 17th. He was 86. Just before he got sick, Ronnie's family visited him for his birthday. Her son took this picture. That look on his face is how they remember him. Proud of the family he worked so hard to provide for, and grateful for the joy they brought him in return. Jesse Johnston, CBC News, Abbotsford.
Time now to check in with meteorologist Brett Soderholm. Brett, I know it's been a mixed bag and we're going to keep seeing this mixed bag, but how much sunshine is in that?
Well, I'm happy to say that sun just magically appeared behind me not a minute ago, and now it's kind of just taking a brief break behind the clouds, but it is going to be sticking around for the remainder of the evening, and you know what? I think by this time tomorrow, too, we're going to be seeing it one more time. Let's take a look at the satellite and radar imagery across the Lower Mainland right now. If you're joining us from Abbotsford, you're going to notice the morning started off really quite rainy, whereas down here in downtown Vancouver, it actually wasn't too bad. As you said, Anita, just a little bit of a mixed bag, but now we're looking at some clearing conditions, and that trend's going to be continuing at least for the next few hours. And current temperatures, I mean, look at that, fairly close to seasonal, 19 degrees, bang on for everyone from West Vancouver over through into the Fraser Valley. And as we look ahead to the next foreseeable future, it's going to be pretty dry until first thing tomorrow morning. More showers are in the forecast, but we're going to be able to clear out by the afternoon. And what the weekend has in store, well, I'm going to have that full forecast when I come back.
All right, we'll talk to you then. Thanks, Brett. And a reminder, you can watch this newscast live on CBC Gem, the free app, also where you can find other CBC programs.
CBC Vancouver is also on Facebook, YouTube, and Instagram. And the two of us, we are on Instagram and Twitter, so make sure you give us a follow.
Coming up just after 6:30 tonight, Dr. Murthy is back. He's taking your COVID-19 questions. BC, of course, is loosening up restrictions, so what do we need to know going forward? Give us a call, 604-662-6801, or send us an email.
Thanks for watching tonight online, where we are ad-free during the television commercial break.
Well, an economically crucial diamond mine in the Northwest Territories is facing a precarious future. The company's already restructuring because of low global demand for the precious stones.
Now, as Alex Brockman tells us, COVID-19 is making things even worse.
Diamonds. They're beautiful and breathtakingly valuable, but every dazzling jewel comes from a place like this, carved out of the rock. There's treasure in the backs of these trucks, pulled out of the Precambrian shield. Canada's biggest diamonds have been found here, including this, 552 carats, big as an egg. These mines have put major money in the pocket of Dominion Diamond's billionaire American owner and brought jobs for the Yellowknives Dene in Dilo.
We are the original miners in the north. Our people are called Twisantee, which means metal or copper people.
In Dilo, 30 people work for Dominion. Hundreds more depend on mining. But their faith is being tested. Dominion's shut down, laid off workers, and the industry itself is crumbling. World demand has plummeted. In the past 10 years, prices have dropped by a third, driven by a glut on the market and falling demand. And now, the devastating effect of COVID-19 has cut supply lines. For Dominion, it means no more diamonds going out or money coming in. An alarming picture is emerging in court. Documents show the business was built on nearly $1 billion of borrowed money, now owed to bondholders. The representatives in court are horrified, claiming the restructuring plan is an audacious attempt by Dominion to clear the debt and leave them with nothing. In Dilo, the business arm of the Yellowknives Dene is itself a major creditor, owed about $5 million. CEO Paul Gruner says it's not the money now that worries him, and it's not just Dominion.
Here in the territory, we produced $2 billion worth of rough cut diamonds last year. If I look at our business, 80% of that is probably related to mining.
Dominion Diamond declined an interview request for the story, but did say it has a plan for the future and will continue mining in the NWT. But people still wonder, for how long will it last? For Chief Ernest Betsina of the Yellowknives Dene, the layoffs cut close to home.
I probably know majority of the people and know them by name. My people are very resilient.
They'll need this resilience. They're about to face an enormous test. Alex Brockman, CBC News, Yellowknife.
Okay, don't go anywhere because we do have the wonderful Dr. Murthy coming on. We always love it when Dr. Murthy's here. He's answering your COVID-19 questions as we move forward. BC, as you know, has been doing fairly well and keeping the numbers low. So what do we do to make sure that continues to happen? Any questions you have, you can always send us an email, right, Mike?
Or if you're online, just leave a comment in the comment section, or a question, even better, in the comment section.
Or well, you can also call us 604-662-6801. We will be back shortly. Months into the COVID-19 pandemic, and the number of confirmed coronavirus cases has passed the 2 million mark in the United States. The border between Canada and the U.S. has been closed to non-essential travel since March, with no opening date in sight. A key concern is a resurgence in cases in America and states that are easing pandemic restrictions. CBC's chief political correspondent Rosemary Barton spoke with the top infectious disease expert in the U.S. about what those troubling spikes could mean for reopening the border.
I want to talk a little bit about the reopening process in the United States, because over the past week or so, we have seen some increases in cases in places like Texas, California, Oregon. Does that tell you that the reopening is happening too quickly? What are your concerns around that?
Well, I mean, obviously, one of the concerns that we have is that whenever you start to reopen or get to some degree of what we call normality, there will be increase in cases. That will be inevitable because you're pulling back on the mitigation that has successfully controlled the outbreak. And we know it has successfully controlled the outbreak. The interesting and important thing is, do you have the capability, the resources, the manpower, the testing, and the ability to identify, isolate, and contact trace so that you can blunt those little blips and prevent them from becoming true rebounds of infection? That's what we have to see, because you're right. We are seeing the appearance of additional infections, particularly in the areas that are opening. So right now we have to make sure that we can handle those. If we handle them well, we could be okay. If not, then we really have a significant problem.
The border between Canada and the U.S., as you know, was shut down to non-essential travel towards the end of March. Can I ask you what you think should be the criteria for reopening the border between our two countries? What would you like to see in place on both sides in order to make that reopening safe?
I am not an expert on closing and opening borders. What you would like to see under any circumstances that go well beyond the opening and closing of borders would be to see a significant diminution consistently in the number of cases, hospitalizations, and obviously deaths. In the United States, if you look at a whole, we have a significant diminution in the number of deaths, a significant diminution in the number of hospitalization. We also, as a whole, have been going down with cases, but I think what you mentioned about some states now having an increase in the number of cases makes one pause and be a little bit concerned. But I don't want to extrapolate that to making any statements about border closing.
You can see more of Rosemary Barton's interview tonight on The National. That's at 10 o'clock on CBC TV all across the country.
And it is a dire situation in the U.S. COVID cases spiking there mere weeks after reopening started. And as Susan Ormiston shows us, there are hard projections of what price in human life that may end up carrying.
Prosecute the police! COVID cautions severely tested when protests swept America, gaining in size and strength. Many cities immediately urging demonstrators, get tested. One more worry about coronavirus spread. Not at the White House.
We may have some embers or some ashes.
Trump continuing to smother concerns.
We'll stomp them out.
Today, more like flames than embers, the U.S. stock market's worst fall since mid-March.
I think the question is, did we reopen too soon? Is a valid one.
COVID hospitalizations at a record high in Arizona. U.S. cases toppling 2 million, rising in 21 states, even after Vice President Mike Pence said, don't worry.
We don't see an increase in new cases now, nearly 2 weeks on from when the first protests took effect.
It's too early to tell conclusively, say health experts. Projections show spikes now will result in tens of thousands more deaths.
We're seeing right now about 180,000 deaths, total deaths, until the end of September.
The U.S. recovery, more of a shallow downward slope than a flattening curve. In Canada, a more demonstrable decline. The U.K. marching clearly down, while Italy's shape, what everyone seeks. Dr. Mokdad says the U.S. and Canada are going in the right direction, but beware the autumn.
There is a decline all the way till the third week of August, and it starts going up after that. And it will start going up even rapidly the second week or third week of September.
So just as worries resurface about this virus and reopening, President Trump announces he'll go back on the road for large campaign rallies beginning in a week. Susan Ormiston, CBC News, Washington.
Now, we've been hearing a lot about the need to reflect Canada's population in Canada's institutions. And the Prime Minister has boasted about having gender and ethnic diversity in his cabinet. But as Salima Shivji reports, when it comes to the federal civil service, it's another story.
Thank you for being here.
A dramatic show of support from a Prime Minister big on symbols.
Because it's 2015.
When Justin Trudeau first unveiled a gender-balanced cabinet, he also promised his government would reflect the country.
A cabinet that looks like Canada.
But there still isn't much color behind the scenes. Of 37 chiefs of staff, just 4 are visible minorities, 11%, less than half their actual presence in the population. Omar Aziz worked briefly as an advisor in Chrystia Freeland's office.
I would go into meetings and I'm the only non-white person there. I felt that when I would raise my voice and give my advice that it wasn't taken seriously.
The Liberals have doubled the number of minorities named to run agencies, boards, and crown corporations, but they lag when it comes to deputy ministers, the senior-most level.
We use a risk.
Caroline Xavier became the first black civil servant ever to become an associate deputy minister in February.
How come it took so long? It shouldn't have. The conversations are happening. There's a recognition at the most senior levels that this has got to get rectified.
One conversation that isn't easy, that black employees are often at the bottom of the salary scale.
We keep having committees and reports, and to be honest, we're coming up with the same data. We have to eliminate these barriers.
Barriers like language requirements and the need for regional representation. Also, employment equity laws use the broad term visible minority, assuming the reality is the same for a black Canadian as for a South Asian. It's not. That language may change, but 5 years after that photo op, revamping the public service has even more urgency for the Prime Minister.
This is a moment where Canadians are recognizing that there is unfairness built into our system.
With protesters ready to hold him to his promises. Salima Shivji, CBC News, Ottawa.
Thank you.
Well, that time is coming up. After the break, Dr. Murthy is taking your questions about COVID-19. Where do we stand now, and how careful do we need to be? Call us 604-662-6801 or send us an email or a message in our online chat.
Across Canada, thousands showed sympathy for the anti-nuclear cause. There were demonstrations from St. John's to Vancouver. The largest was in Winnipeg, where more than 15,000 marched through downtown streets. Further west, thousands more joined the anti-nuclear cause. Jerry Thompson reports.
On the West Coast, thousands of people showed up at the Peace Arch border crossing, despite the fact that it was hard to get there. It's 50 kilometers south of Vancouver, so people had to be bussed in. And because the RCMP closed the border for 5 hours and diverted freeway traffic away from the Peace Arch crossing, many people were forced to walk a long way from where they parked. Even if the total turnout was slightly disappointing, the broad mixture of people, all kinds of people, convinced sponsors of the rally that the nuclear disarmament movement has caught on out here. It's no longer just theater of the absurd. It's something that people of all ages and backgrounds are willing to support.
You know, I think of my grandchildren, and they're pretty precious to me. I would certainly like to see things straighten out and a little more peace in the country, in the world.
Jerry Thompson, CBC News, at the Peace Arch border crossing.
British Columbians know the meaning of rain, but this spring, umbrellas are working overtime. BC is suffering its wettest excuse for spring since 1936. Spirits are soggy in Vancouver, and elsewhere in southern BC, farmers face multi-million-dollar crop losses. Sue Stern reports.
It's been overcast and raining in the lower mainland for over 70 days now. 300 millimeters since the beginning of April, more than double the normal amount. The long-range forecast predicts another month of it. And as the saying goes, in Vancouver you don't tan, you rust.
I think it really stinks. For the first time for a long time, I think it really stinks.
Here in the Fraser Valley, just outside of Vancouver, the farmers are in trouble, big, deep trouble. Endless rain and just patches of sun are spelling disaster for the lucrative vegetable crops. This area is one of the most productive growing regions in Canada, but Andy Stetter's 170 acres of potatoes, onions, and carrots are nothing but mud.
You know, you have to fight to get the crop in, and then once you get it in, if it doesn't flood on you, you can't get in the field to, you know, to cultivate or to spray or to do any of the things you have to do to look after the crop. It's very frustrating.
Stetter usually takes in around $320,000 a year, but figures he'll be lucky to make a third of that. He may have to borrow $50,000 to $100,000 to pay for fuel, wages, fertilizer, and seed for next year's crop. And for BC and prairie consumers, the damaged crops mean more imports and higher produce prices this year. Sue Stern, CBC News in the Fraser Valley.
Here are some of the stories we're following tonight on CBC Vancouver News.
It confirms the disaster that continues to unfold in British Columbia.
BC has recorded the highest number of fatal drug overdoses in a single month, 170 deaths. In fact, in May, overdoses claimed more lives than COVID-19 has claimed all year in our province. Experts say the current drug supply is highly toxic and right now is a dangerous time for users.
At the municipal level, we could have these conversations at the board level, but in the end, the buck stops at the province, and this is why we need a review. If we wanted a fundamental change in policing, it can only come through the province.
The province is answering the Vancouver mayor, and says it will do a review of policing across BC to see what changes can be made. This comes in the wake of protests in Vancouver and around the world calling for systemic change to policing.
Teams would have no contact with the public, with no spectators, and no families. So it is the concept that I have said meets our criteria.
Some clarification today from Dr. Bonnie Henry on what it would take for Vancouver to be an NHL hub city. If an agreement is reached, no team could have more than 50 people, possibly fewer. They'll be in isolation for the whole time, likely well into the fall. And as you heard, families won't be allowed inside the bubble.
Well, it's that time in the show where we take your COVID-19 questions and put them to our expert. Infectious disease specialist Dr. Murthy is here taking your questions. Give us a call quickly, 604-662-6801, or message in the chat if you are watching online. Dr. Murthy, always good to have you on the show.
Hi, Anita. Good evening.
Okay, let's get right to it. Todd Gogol says, can we possibly over-disinfect, sanitize, and wash our hands? I understand the importance of these practices in preventing the spread of the virus. However, are we now not exposing ourselves to good bugs important to our collective good health?
You know what? At this point, that's not my primary concern. I think focusing on the coronavirus and making sure we get past this episode, and then we can worry about some of the disinfectant issues that Todd is bringing up there.
Okay, Fiona says, should servers in restaurants be wearing face masks or not? I think you go to various restaurants or we walk past them and we see a total mixed bag.
Yeah, I think the current recommendations where if you can't physically distance, to wear a face mask for the benefit of others around you hold strong. And so if people don't wear face masks in restaurants, they must be very confident that they're able to physically distance. I think most restaurants should have some face masking policies in place.
Well, let's talk a little bit more about face masks because there's a new study out from the WHO co-authored by Vancouver's Dr. David Harris. It says masks do help. Why has it taken so long for this to come out? We are now into our 4th month. Wouldn't a lot of infections have been prevented if we had been masking earlier?
Yeah, that's a great question. And the mask issue is obviously something that comes up very frequently in public health circles. With this WHO report, it says that masks may have benefit for decreasing the overall loads of infection. Whether that works backwards and whether if we had worn masks throughout from January onward, we would have had less disease in Canada. It's possible, but it's difficult to say right now. I think moving forward, wearing masks with the current recommendations of where you can't physically distance to wear them, especially if you're in a closed or inside.
Where are we with asymptomatic spreading? I know we hear a lot of different things. Are people spreading the virus only if they have symptoms, or is it still being spread by those who don't show any signs?
So the predominant spread of the virus is by people who have symptoms. There is a component, which we don't know exactly how much, of people who are pre-symptomatic who can spread the virus. And there's different studies that report up to 40% of all diseases spread this way. People who are completely asymptomatic, so have no disease throughout their entire infection, we don't know how much spread happens with them. I think in that context, making sure we keep our hands clean all the time when we're symptomatic and even when we're not symptomatic and making sure we maintain our physical distance as much as possible.
People consider you an expert. You are an expert, so I'm sure you have a lot of different conversations. Are you hearing a lot of confusion about what to do here in BC, what not to do?
To be truthful, like, compared to my friends I'm talking with across the country and in the United States, I think there's much less confusion here. I think we've been fairly sort of consistent as to how we're opening up slowly right now, with schools and restaurants and some bars opening up. Hopefully that trajectory continues. But when you compare us to other jurisdictions across the country and around the world, I think that confusion is much less.
A viewer on YouTube wants to know, is there any perspective of second wave of COVID-19 likely to be stronger or weaker than the first?
That's the trillion-dollar question, I guess you could say. It's very difficult to say whether the second wave, which we have to presume will be inevitable, and if it doesn't come, we should consider ourselves lucky. Will it be worse than that first wave? It's difficult to say. And I think as long as we maintain vigilance and we keep doing what we're doing, hopefully we can keep that curve reasonably flat.
Kathy wants to know, she says, one of my doctors, a specialist from St. Paul's, told me that COVID tests are 20 to 30% inaccurate. What do you think, Dr. Murthy?
I think the numbers depend a lot on how you do the test, A, and B, who you do the test on. And so if you're doing them on asymptomatic people, you may get some results that aren't exactly accurate. If you do them on completely or symptomatic people, you'll have more of a positive result. And I think with that, I wouldn't say 20 to 30%. I'd say much, much higher than that, or much more accurate than that.
From what you're seeing, being on the front lines and talking to people, the cases that you're seeing, how is this virus being spread the most? Are we looking at public places like grocery stores? Are we looking at close contacts, family members living with each other? What are you seeing?
Predominantly, it's close contacts for prolonged periods inside. And those things are typically families and institutions like long-term care facilities or meatpacking plants or prisons. And so those are the main areas where the disease is transmitted. Outside in public, in parks, where you walk by someone is a low-risk exposure. And running around or biking and keeping moving is also low risk.
Okay, we have one last question. It's coming in. They're typing it as I'm reading. Larry wants to know, we've got friends wanting to visit us from the interior in November. How should we respond? And I think we can just broaden this out, right? I know that Dr. Henry is talking about travel within the province, but people who want to visit family members, hop on a ferry and come over to the mainland. Are they, and should they be doing that?
I think November is a long time away to look into a crystal ball to say what exactly is going to be the situation then. And the province is constantly updating its recommendations as to where and how public should move around the province and around the country. And so I think staying vigilant to those messaging to make sure that we stay safe.
So at this point, would you hop on a ferry and go over to the island?
I haven't yet, no, myself.
Okay, Dr. Murthy, thank you so much for being on the show today.
Take care.
Well, lights, camera, action. The film industry is restarting, but it's not going to be business as normal. We'll tell you what it's going to look like coming up.
And at 6:46, a live look at the North Shore. Nice to see the showers ease off today on the South Coast, but they'll be back. Brett will tell us when next.
The weather update is brought to you by WorkSafe BC. Visit WorksafeBC.com for workplace health and safety resources, including COVID-19 prevention.
Meteorologist Brett Soderholm back with us now. You know, when you say unsettled, I like the part of unsettled where the sun actually comes out. That works out well.
Exactly. That's the best part. It really is such a good term to use because it's never going to be a complete washout day when I use that word. And I'm happy to say the sun definitely is out right now, and it's going to be continue to do so for the next little while. But other parts of BC right now, not so lucky. And I want to take you actually into the interior with a look at the radar right now, because earlier today, Environment Canada had issued severe thunderstorm watches for portions of the Okanagan and into the Kootenays. And as we're looking at this right now, you can see a couple of lightning strikes, and this is indicative of thunderstorm activity just around Kelowna, between Kelowna and Vernon on Highway 97, and the atmosphere really unstable there. That's going to be continuing for the next couple of hours. Now, as I've been mentioning all week, this general unsettled pattern that we've been in really is all thanks to this area of low pressure, but it's going to be doing something a little bit differently now as we move ahead. It's going to be coming inland, and as it does so, it's going to be bringing with it a decent amount of rainfall for two distinct parts of the province, and fortunately, I guess you could say, it's not going to be us here on the south coast. Instead, one of the first areas to be mentioning is down into the East Kootenay region, and especially along Highway 1 between Revelstoke and Kamloops, have the potential there to be accumulating upwards of 60 millimeters of rain throughout the weekend. But farther to the north and east, Fort Nelson possibly exceeding 100 millimeters of rain by the time that Monday rolls around. Here on the south coast, by contrast, it's just going to be closer to about 10 to 20 millimeters or so, and we've only seen about 20 millimeters this month, so we will gladly take that for the next foreseeable future. Now, temperatures are going to be still on the cool side of seasonal here in Vancouver, and they'll be dropping down as well come Saturday into the interior. But as for a 5-day forecast, I am deliberately being optimistic here. We are looking at the potential for a few showers come Saturday for the weekend, but I do think Sunday is going to be the better one with lots of sunshine and only a few clouds throughout the day.
Good news, Brett. Thank you. Lights, camera, hand sanitizer? What a restarted film industry will look like in the time of COVID. That's next.
Well, as the film and TV industry adjusts to the new normal, some provinces are returning to work. Quebec and Manitoba have already been given the green light, and in Ontario, at least outside the Toronto area, cameras can roll beginning tomorrow.
Here in BC, the industry is expected to reopen next week. But as Eli Glasner explains, some productions still face one major hurdle that only Ottawa can help them clear.
2 hours north of Winnipeg, Dr. Carey Prairie Vet is one of the first shows to resume filming. But in this new normal, it's lights, camera, caution.
Everything is cleaned, and sanitizers and masks are made available to every single person who comes in contact with us. So we're making an effort to bear the burden of those additional costs.
The producer of CBC's Burden of Truth says COVID is even changing what writers write.
We've asked them to do their best to write us things that can be accomplished within the new protocols and guidelines without affecting the creative too much.
So all of these walls can already shoot up into the ceiling on these motors.
In Vancouver, where many American shows are shot, the border is open for people with valid work permits, although they still have to quarantine for 14 days.
So these are all patient rooms here.
As The Good Doctor gets ready to resume shooting soon, producer Sean Williamson says they're making more space and using remote cameras to keep crews safe.
We very often would cram 25 people into a small room like this. Now we'll cram 3 people in.
With a plan and relatively few COVID cases, Vancouver is in demand. But they're still struggling with how to film intimate scenes safely.
If you sanitize your hands and the other actor sanitizes their hands, you can hold hands because effectively your hands are now clean and clear of the virus. But kissing is a different thing.
But for productions that didn't have a contract before the COVID shutdown, there's a major problem.
Insurance.
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 Insurance companies are refusing to cover any future pandemic-related claims. The Canadian Media Producers Association has proposed the federal government underwrite a new fund producers would pay into.
We have to sort it. There is absolutely no choice. A huge chunk of production won't happen without it.
With the Producers Association estimating billions of dollars of work could be lost, it says Ottawa needs to move fast or those cameras will roll elsewhere. Eli Glasner, CBC News, Toronto.
Yeah, a lot to deal with. Insurance, the 14-day quarantine, but they will try to get productions back and going.
Yeah, it's not easy, but people are watching more Netflix than ever, so the content is in demand.
I think I've run out of stuff. There's nothing left on Netflix. I've watched it all.
I can give you a few shows.
All gone.
That's it for our news program tonight. You can always find it online, cbc.ca/BC. Dan is here at 11 o'clock after the National.
Good night.